Yes, I think you can start. Good evening, everyone. On behalf of AutoUse, I welcome you all to this special webinar on dry eye in digital age on the occasion of World Sight Day. I'm Bharat Kumar Hegde, co-founder of AutoUse. AutoUse is a healthcare startup working towards providing accessible, affordable, and scalable solutions to ensure better eye care delivery. On this occasion, it gives me an immense pleasure to introduce to today's speaker, Dr. Mathew Kurian. Dr. Mathew obtained his MS in ophthalmology from St. John's Medical College. He comes with a rich experience of more than 2 decades, having held multiple senior level positions at Birla Eye Clinic, Kolkata, Narayan Netralaya, Bangalore, with a specialization in anterior segment eye care. Dr. Mathew is a high volume cataract and refractive lens surgeon with a keen interest on research and innovations in ocular surface behavior, including dry eye. Currently, he's the medical superintendent of Chaitanya Eye Institute, which is one of the biggest eye care chains in India. It gives me immense, it's a privilege to welcome an expert like Dr. Mathew Kurian to deliver today's very relevant and much needed talk on dry eye. Over to you, Dr. Mathew.
Thank you, Bharat, for those kind words. I'll start with my presentation and share my screen.
Sure.
So today is World Sight Day, and this is a day which is founded by the International Agency for the Prevention of Blindness, with the idea of spreading awareness about eyesight and problems related to eyesight to increase awareness and advocacy towards problems related to sight. The theme for this year is Love Your Eyes. And on this occasion, I will be speaking on the topic of dry eye in the digital age, which is very relevant to all of us who are using different digital modes. As part of the theme for this year, the 4 P's of Good Eye Health Guide is what is being promoted. And this includes to prevent eye disease, because many eye diseases can be prevented by adopting a healthy lifestyle and includes healthy habits and healthy eating. We talk about protecting the eye, and especially in the digital world, this is something that is very relevant because we want to maintain a decent screen distance, we want to have a good posture, and we want to minimize the risk from the number of digital devices that we use. And the entire talk today is based on this one. The remaining 2 P's is to preserve vision. And the idea of preserving vision is to have a regular comprehensive eye examination to understand the medical and family risks associated with our vision. Finally, we need to prioritize that vision is an important part of our daily life, and we need to consider this theme of Love Your Eyes as a life mission, not only for you as an individual, but for your family, loved ones, and community. And that is what this theme is all about today. My presentation today is for general information. It is for awareness creation and educational purposes. It is not intended to be a substitute for medical advice, diagnosis, and treatment. And this is not an endorsement of any product or service. Before we can go into the disease itself on dry eye, we need to understand what tears are and how it is produced. So this is a picture of the eye. On the top there is the lacrimal gland, which produces the watery component of our tears. And the surface of the eye, the white portion, produces what is called as mucus, a little sticky stuff which enables the watery material to coat the eye. And on the eyelids are these multiple glands which secrete a little bit of oily material which coat and protect the water from evaporating. Finally, all this tears that is produced flows out through small openings near the nose into the lacrimal sac through the nasolacrimal duct to the back of the eye, back of the throat. The tear film itself thus comprises of an outer oily layer, a middle watery or aqueous layer, and against the cornea, the eye surface is the sticky mucus layer. And much happens during a blink. So when the eyelids are open, the tears start to dry up. Each blink pushes out the oily material, which then is spread out over the surface of the eyelid. And this is the entire complex is what protects the eye. Remember that every minute we are blinking about 20 times. So that means every 2 to 3 seconds, this protective mechanism is working on the surface of our eye. Sometimes the oily material is very thick. Okay, normal one is like these watery droplets that you can see. Sometimes it becomes a little thicker and milkier with age. Sometimes it becomes much more thicker and sticky, and rarely it can become really thick like toothpaste and prevent the oily material from acting as a good protective for the material for the tear surface. So hot fermentation, a very simple exercise. Dip a towel in warm water, squeeze out the warm water, and apply that warm towel to your eyelids. This increases the eyelid blood flow, tends to melt the solidified tear secretions, and a gentle lid massage can then unblock these tear glands. But this is something that needs to be done not just once or twice. It needs to be done regularly, 5 minutes morning, 5 minutes evening, for 3 to 6 months before it gets some use. So thus we have two types of dry eye. One, where the aqueous itself, the watery material production is deficient, that is called as aqueous deficient dry eye. Or two, where the lack of a protective mechanism allows the tears to evaporate very fast, and this is called as evaporative dry eye. Let's look at the definition of dry eye. The Dry Eye Workshop came out with a report in 2017. This was a large group of international experts in the field of dry eye. They said that dry eye is a multifactorial ocular surface disease characterized by a loss of tear film homeostasis accompanied by ocular symptoms in which tear film instability, hyperosmolarity, ocular surface inflammation and damage, and neurosensory abnormalities play etiological roles. That's a long and complicated definition. Essentially, it says that there are a lot of things which go into maintaining the tear, that is the normal homeostasis or the ability to maintain the normal tear film. And the loss of that ability can be resulting in ocular symptoms, dryness, discomfort, etc. And many of these factors play a role in it. So how do we go about measuring these symptoms? Simplest is questionnaires. Smaller and simpler questionnaires are available, but one of the landmark questionnaires that was available is what is called as the Ocular Surface Disease Index, or OSDI questionnaire. This talks about the frequency of symptoms that an individual feels, and you add up those scores. Totally 12 questions are there, and then there is a method of calculating what is normal. Normal is score of less than 12. Mild disease is between 13 to 22. Moderate disease is 23 to 32. And severe disease is greater than 33. So this is a complex questionnaire, but it gives a fairly detailed information as to what causes your dry eye. Many tests are available, but like if you look at the most common disease on everybody's mind today, COVID, fever, cough, you do the RT-PCR, test positive, you have COVID, test negative, you don't have COVID. That's very easy. But when you look at tear film evaluation tests, there are so many tests. The ones that are commonly done are called as the Schirmer's test and the breakup time, but so many other tests are there. And this is basically an indication to suggest that none of these things give a true measure of what tear film instability and what is happening on the ocular surface. So what is tear film instability? A normal blink rate is once in about 3 seconds. And the tear dries up on the surface usually in about 10 or more seconds. So typically what happens is that a blink happens before the tear dries up, and this is okay, this is normal. Typically an individual should not have a symptoms at this stage. But for whatever reason, if the blink interval increases, or because you're focused on a screen because of concentration, you are in an air-conditioned room because of the dryness, or if there is inadequate oily secretions on the tear film and there is evaporative dry eye, typically what happens is before the next blink happens, the tear breaks up. There is the unprotected surface. Initially, for some time, there may be just discomfort, but then months and years of this add together and the ocular surface is actually damaged and there can be staining and congestion over there. So this is typically what happens in digital eye strain, where the tear breakup happens before the blink. Hyperosmolarity. A very simple thing. It basically says that when the tears are dry, the chemicals in that are more concentrated, hyperosmolarity. Okay, but it's not so easy to measure. There is a lot of variability between one blink to next blink, between the right eye of an individual to the left eye of the individual. So many changes are there and they're not really easy to measure. Devices are available to do this today, which are basically lab on a chip kind of devices. These are quite expensive and unfortunately they are not very easy to give a consistent differentiation between a healthy eye and an individual with a problem. Inflammation and redness, yes, this is pretty easy. You look at the eye looks red, congested. You can just look at yourself in the mirror or take a selfie and this will typically be able to tell you what the problem is. Ocular surface damage, there are many methods of doing it, but usually what we do in a clinic is to apply a special stain, chemical, which gives a color to the damaged portions, and you can see the small spots that are there or these scratches appearing there, and these are the damaged areas of the cornea. Neuro-sensory abnormalities, basically it means that the eye is very sensitive to pain. And this was by my former colleagues at Narayan Netralaya that was published in an international journal in 2019. So many things are there, but bottom line is it has an impact on vision. So when the surface of tears in front of the eye is irregular, it's like having raindrops on your car windshield. You can see blurry images, which may not be very sharp and not very bright, that is loss of contrast. You can see spots of light which tend to appear very bright, and that is glare. You can see double images, and you can see some images which appear very scattered and distorted. All these, all of us who have driven in a car during the rain would have experienced it. You put the wiper on and you see, you get a regular uniform layer of tears, a uniform layer of rainwater in front of your windshield, and you can look through that with good quality vision. Each blink is like a wiper going up and down. So this is what normal tear and normal blink function does for our quality of vision. Let's move on now to our current problem, which is digital devices. The traditional name for this was computer vision syndrome, which is a complex of eye or vision problems which are experienced during and related to computer use. Today, if you ask many people, they will deny the presence of a computer in their house, but they are using digital devices, be it a mobile, a tablet, a laptop, desktop, or a television. And the sum total of this has caused us to change the name of computer vision syndrome and call it as digital eye strain. A typical working rule for this is handheld devices, mobiles and tablets should be about 1 foot in front of the face. Laptops, desktops should be about 2 feet in front, and televisions should be approximately 10 feet. So the working distance for comfortable, healthy use of these is 1, 2 to 10. The problem is that all these digital devices are pixels, individual squares of light, which have a gradient from the background color, which in this case is white, to darker central colors. And as the pixel size, the dot size of the pixels becomes smaller and smaller, the refresh rate of these devices becomes faster, the brain finds it easier, the eyes find it easier to focus. So look at the image on the left where the coarse pixels are there. The image on the right is much easier to focus on. The eye tends to keep moving back and forth between these, assuming that this is out of focus, and try to improve the focus. And that is what causes the strain. So we know that approximately 80% of individuals use a screen more than 2 hours in a day. Approximately 2/3 of these individuals blink less frequently, and that causes nearly 90% of all these individuals to have various symptoms. What are these symptoms? These symptoms can be as simple as eye strain, headaches, blurred vision, a feeling of dry, burning, irritated eyes with some foreign body or dust particle in the eye. So what do you do about it? You need to correct even a small power if you have to reduce the strain. It may not be relevant for normal daily activities, but when you're in front of a digital screen, it's very important to correct this. You should consider using anti-reflective coatings when indicated to reduce the glare and reduce the indirect reflections from the screen. A tinted or photochromatic glass will take care of brightness and contrast issues. Those above the age of 40 that require reading glasses as well as distance spectacle prescriptions should consider the use of progressive lenses, because the computer screen is often at an intermediate distance. So what do we mean by that? From the eye, 1 foot or handheld devices are near. Distance is more than 20 feet away. A laptop or desktop screen is typically about 2.5 feet away, which is intermediate. And only in a progressive lens, you have a distance, intermediate, and near segment. And then intermediate segment helps you to see the laptop or desktop clearly. In the absence of that intermediate segment, what happens is that individuals will tend to lean forward and tilt their head back to look through the bottom portion of the spectacles. And this ends up with repetitive strain injuries to the back, shoulders, or neck. So workplace ergonomics is very important. And this is what is defined as the setup of your place. Leaning forward, inadequately supported, poor backrest, no. We should consider a chair where the head eye level is such that the screen is slightly below the eye level. The back and thighs are well supported, and there is 90 to 110 degree angle at the knees, and the back is well supported. You can also consider using some of these standing devices to help you to reduce your seating time at work. The chair should be height adjustable with good support. The screen, remember the 1, 2, and 10 rule, and it should be perpendicular to the line of sight, slightly below the eye level. The larger the screen, the better it is. Use an anti-glare finish or a matte finish screen with the highest possible refresh rate and resolution, though it may come with an increase in cost. And when at all possible, consider increasing the font size that is being used. With regard to the setup, the office is often professionally done and there is limited flexibility. But now with work from home, most often we are just using the system wherever we can, and we should consider the glare, reflections, wind onto the face, etc., to improve our comfort levels. So wind itself, we need to have good ventilation, and we should make sure that air conditioning vents or fan does not blow the breeze directly onto the eyes. The ambient lighting in the room is very important. Compared to a normal room, you can use half that brightness in a room where there is a system being used, and the computer screen brightness should be equal to that of the room environment. We need to take small breaks. Just remember the 20-20-20 rule. Okay, what it means is not to take a 20-minute break for every 20-second of work. Your HR will certainly catch you if you try to do that. You need to take a break for just 20 seconds. Okay, for every 20 minutes of work, and give your eyes muscles some break by looking at something more than 20 feet away. This is the 20-20-20 rule. Preferably, don't spend the entire day sitting down. When you do this 20-20 break, you also try to stand up and move around to prevent this kind of hunched over look that is very common in long-term computer users. The third and final component of this is to wet up. As we work with concentration, our blink rate tends to reduce. So remember to blink. It sounds silly, but remember to blink. We need to use tear supplements for lubrications as and when required. Consider some drops. In individuals with a lot of problem, use a higher viscosity drop. If required, some gels. Special formulations are available to improve the osmolarity of the tear surface. And various type of omega-3 fatty acid capsules also supposed to have a role in improving the tear quality. Let's now move on to digital well-being. We tend to get hooked onto apps that are there onto your phone, and they sort of are very addictive. We can put a timer to the app, and we can say that we want to limit the number of minutes or hours that we are going to spend on any time, on any app. We can wind down, and we can set out a schedule by which we can have the screen become gray at the end of each day at any preset time towards bedtime preferably. And this will help us to not only keep track of the amount of hours we are spending on a particular app, but also make the app less interesting and appealing between bedtime to a normal waking hours. Other things that we can do is to go into a dark mode and to consider something called as adaptive brightness. Dark mode again is on the settings where we can choose a blue light filter and the dark mode to make the screen less, create a less of a glare for our eyes towards the evening. Again, in the settings, we can choose the dark mode. We can make the adaptive brightness on and off such that automatically the screen will reflect the room light changes or the ambient light changes that are there. All of these, the dark mode as well as the blue light filter can be set from sunset to sunrise or according to a custom schedule so that it happens automatically for us. In the blue light filter, our screen gets an orange hue, and the orange hue creates much less glare than the white light that is normally present on our screens. The general screen rules, almost everybody has seen an increase in the screen time because of COVID. Screen addiction is an illness, and the likelihood of increasing minus power in children, especially, or myopia, is much higher when there is a lot of near work. So in certain countries, the percentage of children wearing minus power glasses by 12th class is almost 90%. So the duration of online classes must be age appropriate for children. Less than 3 years, kids should not be encouraged to have any online classes. 4 to 6 years, max 1.5 hours, but with a break in between. 7 to 12-year-old kids can have up to 2 hours of classes, but with 2 to 3 breaks in between. 16-year-old children can have 6 to 8 hours per day, but they should include breaks and include a long lunch break. More importantly, parents should be actively monitoring what is happening on screen and activate parental control features when required, set clear rules about screen use only for educational purposes, and educate the children about how to use the internet safely and to be vigilant about what else is happening. We finally need to remember that we need to prevent refractive errors or minus power increasing in children. And this can be possible by encouraging children to spend at least 2 hours outdoor doing activities which involve distance vision. There's no point in just going outdoor and continuing to use the mobile. So outdoor is also for sunlight exposure and exercise your distance vision. So to recap, we had a discussion, started the discussion with understanding something about tears. We talked a little bit about dry eye disease. We talked about digital eye strain and the setup, get up, wet up rules to help us to reduce and better handle the strain that we face in our professional activities. We talked about digital well-being that is applicable to all of us. And we talked about some screen rules for children. Thank you. And just sharing the locations of Chaitanya Eye Hospital Group that is serving Central and South Kerala for the last 25, 26 years. Thank you very much for your attention.
Thank you, Dr. Mathew, for the wonderful session and very valuable and relevant inputs. Can we have 5 minutes for a Q&A session, maybe a couple of questions?
Sure, sure.
Okay. So I would request if any of you have questions, you can put it in the chat box or you can unmute yourself and ask the question. So there's one question from Namita. She's asking, are there any medications that interfere with healthy tear film?
Yes. So routine medications for most individuals do not interfere with the tear film, but a certain type of drug components can alter the tear film a little bit. Usually, these will also have a lot of systemic general health side effects like dry mouth, etc. also. So it may not necessarily be the primary cause for discomfort for the individual.
Okay. Namita, does that answer your question?
Yes, thank you.
Thank you. Anyone else? And today with us, we have Dr. Shyam Vasudev Rao, who is the kind of leader in the medical device domain, having successfully started and running multiple ventures. So I'd request Dr. Shyam to share his thoughts. I think.
Hello.
Yes, yes.
Oh, can you hear me? Okay.
Yes, yeah.
Oh, thank you, thank you. I think we are the shishyas of Dr. Mathew, and Dr. Mathew has been a very, very long associate, and I've seen him, grow from in his profession from stage to stage, and he has really, done a lot of work in this field. So thank you, Dr. Mathew. It was wonderful hearing you again, and a lot of very important things. And the problem looks so simple, but it's one of the most complex problems, I would say. And you really put it across very nicely, and given wonderful tips on how one should manage it. Thank you. Thanks for that good talk. Thank you.
So I see a
Thank you,
question.
Bharat.
Yeah,
Thank you, Shyam. I see a question in the chat box. Will washing eyes with water mixed with honey help? So basically, the tears is a fairly complex entity, and altering the natural properties of the tear film by introducing water, even if it is sterile water, risks the eye, increases the risk of infection or allergies in the eye. So I would be fairly hesitant in using water with honey or anything like that in the eye. Lubricants which are designed for use in the eye can be used in the eye. Other than that, I think hot fermentation, moist heat over the closed eyelids 5 minutes in the morning and evening is probably one of the best things that you can do in order to improve the natural tear quality, which gradually reduces with age.
Thank you, Dr. Mathew. Any last one question? Okay, I think we don't have any more questions. So I'd like to thank everyone for joining this webinar. So it's so late in the evening, and still you all of you guys have taken your time out of your schedule, and thank you so much. And please reach out to us if you have any questions or queries regarding any of the eye care in general. And once again, thank you, Dr. Mathew. It was a wonderful session listening to you, and it's a very relevant topic that you have covered, and lots of useful inputs and tips to avoid